So we're going to do range of motion of the thoracic and lumbar spine. So if you come up here with me, shoulder to shoulder, we're going to reach down towards our toes all the way. It's really good range of motion. That's at least 90 degrees. I'm going to have you cross your arms, go back, and that's well more than the 30 degrees we're looking for. That was closer to 45. Now I'm going to have you face me, have you put your arms at your side and swing this hand down towards your knee. It's at least 30 degrees of lateral flexibility on the right and the left. And now I'm going to have you put your hands like this and have you rotate this way and rotate this way, which is at least 30 degrees of rotation in both the left and right direction. And that is all the tests for the low back. Let's go ahead and include the knee special test in this video. So I'm going to have you get on the table and then go ahead and just swing your legs around over here to me. And let's go through some of the knee tests at this point. For those that are interested, for those that are not ready for this information, just go ahead and shut it off. But go ahead and I'm gonna do allotments here. So I'm gonna take my left hand and I'm gonna brace it up here against this knee. And I'm gonna have them relax. The biggest culprit to knee testing is a tight quad. Okay. And there's good motion in that. So that ACL is good. So I'm trying to get kind of a rocking motion. So as I'm pushing down, I'm lifting up. I'm trying to translate that tibia forward, and that is all equal. The next thing I'm going to test is I'm going to bend the knee at a slight angle like this, and then I'm going to put a force at the knee, and I'm going to kind of rock this back, and that's testing her LCL, which is good. So the varus stress is negative. And then let's test the valgus stress here. So now I'm putting the same force on the opposite knee, above the knee. I'm bending the knee just slightly at about 15 degrees, and then I'm rocking that MCL. There's a little bit of play in there. Maybe she went a little hard this volleyball season. Okay, I'd call that 1+ on the valgus stress of her knee. So if we do the opposite here, just to test the varus, no play, and then here, maybe just a little bit of play. Part of that is just the angle of her knees. She's a little bit knock-kneed. So just a little bit of genus valgum with her knees there. The McMurray's test is the last test that we'll do. So we'll just demonstrate that by coming up here. So go ahead and lay it back for me. Let me get you a pillow here. Okay, good. I'm gonna bring this knee up to 90 degrees. I'm gonna create a C with my hand here. I'm gonna bring my thumb over here right along this joint line and then bring these fingers, kind of find that joint line right in there. Okay, so I'm gonna rock this back and forth, and I'm gonna ask her to try to relax her quad because most people will tense it up. Okay, now I'm nice and straight. I'm gonna evert this foot, and then I'm gonna bring it down and bring it up, and you can kind of take it at an angle if you want. Okay, and I'm gonna evert the foot, invert the foot here. It was evert before. And just got good, nice meniscus here. There's no clicking or catching. That is the McMurray's. The other one that you can do to test the ACL is the anterior drawer test. I always grab the back part of their foot here, put this at about 45 degrees, get my hand under here, get my thumbs on either side of the kneecap to stabilize it, and I try to push that out. There's no instability there. All right, thanks for watching.